Perfect. So when we talk about the healthcare management, we are not just talking about individuals who have all of the skills that you may have ever imagined. We do have people who deal with hospital management, those who are dealing with healthcare management. It means human services or human resources. These are people who are dealing with infrastructure management, people with procurement management. So they manage all of the purchasing, for example, or purchasing of the devices, of the pharmaceuticals, a purchase of different equipments for the hospital or for any medical office. So it's really going beyond just managing a small sector, and this is much more, broader. So we talk about the hospital industry. In the healthcare management, we also talk about the pharmaceutical industry. So it's research, clinical research, animal research, packaging, labeling, producing, manufacturing, upscaling, marketing, registration. These are all different activities that we perform when we are in the pharmaceutical industry. We also have another sector in the healthcare management, which is the diagnostics, where we are using different devices, medical devices. We are using several types of even kits that may come from the biotechnology industry. These kits, these equipments, these devices are going to allow us to observe. Now, we may observe medical images. We may observe, I would say, different changes in the composition of the blood through, of course, the blood tests. We may do urine tests. We are going to have MRIs. We are going to have different types of tools that we use in order to perform again the diagnostics. So you see that it's really an industry, talking about healthcare management. It's an industry which is very broad. We can also talk about giving services to the patients. Here we deal with doctors, with nurses, with nursing homes. We are talking here about people, of course, who need some services, and that's why they go to the nursing homes. We can talk about pharmacies. We can talk about hospital pharmacies, management of the hospital pharmacies. We can also talk about health records, electronic health records. We can also look into the trends that we can find in each individual, so that when we are going to have a system that will then get the data related to each and every person, we may now allow doctors, physicians, pharmacists, research, for example, organizations to do more research and, of course, to come up with some solutions that are going to be individualized. This is where we talk about personal medicine. Okay, of course, you may say that we may have some issues with the protection of the privacy, but I'm going to leave it on a side because we do have laws and regulations that will protect our privacy as well. So for the sake of this presentation, I'm not going to go into the privacy and the issues that we may encounter. I'm just going to continue with the healthcare management. And of course, before continuing to talk about each of the sectors in the healthcare management, I'm going to explain, of course, again, what is the use of AI, okay, how we can use it in healthcare management. So what is AI? AI refers to artificial intelligence, which encompasses the use of advanced computer algorithms and models to analyze complex medical data, identify patterns, and make predictions or recommendations to support clinical decision making and healthcare management. So you may say, perfect, all of these algorithms perfect? Of course not. Are they all well suited for a specific population? Of course not. Okay, but we started to have a system with an algorithm. Then we had 2 algorithms, 3 algorithms. We started to continue to work on different algorithms. These are all formulas, I would say. These are all instructions that are being given to computers in a very simple, using simple words, but then they allow the computer to follow a type of flow chart, a type of logic to follow. And then we are using that type of complex algorithms in order to adjust the functionalities of the artificial intelligence for our business. For example, you may find an artificial intelligence application for medical imaging, where we just give to the artificial intelligence algorithms a database and a database of pictures, where it will then be able to distinguish in between normal and abnormal structures of different organs that you may see in a medical image, and then to do the calculations, and then based on the information that we give to that AI, to compare the information, compare what is normal versus what is abnormal, and then to give us a report related to a medical imaging of a, for example, of a prostate cancer. Okay, so AI is limited. It's limited by the algorithms, of course, by the models. It's also limited by how much and with what depth we give information to the artificial intelligence, so that it will go index the information, going and even searching for different terms that we are asking in our question within a database, which is, as I told you, limited as well. Now, what is a machine learning? Machine learning is a subset of artificial intelligence. Okay, in the context of clinical research or in healthcare management, machine learning refers to a subset of artificial intelligence that involves the development of algorithms and statistical methods, models of course, that enable computer systems to learn from and make predictions or decisions based on the data. So when we talk about artificial intelligence, we are looking into algorithms accessing databases, images, different types of data. And when we are looking into the machine learning, we are going to make that process a little bit more specialized, because now we are looking into the development of statistical models. The machine or the algorithm is going to look into the trends, and through those trends, it's going to give us propositions, recommendations, and this is where we can now reach what we call the deep learning. This is, of course, the term deep learning. Now, talking about the use of AI in the healthcare system, okay, here I just wanted to show you a very simplistic, I would say, scheme where we are looking into the self-care, prevention, and wellness. I'm sure that you already had different videos on YouTube or different websites on, for example, on internet, okay? We had the information already available, but people needed to go and read maybe 20 websites. Now we don't know exactly what are the sources, are they valid or not, okay? And that's what I say to my students, no, going to Wikipedia, everyone can go and change or update the content, so it's not a valid source of information. But what happens is that with the AI, we just added an automation to that search. So instead of you going to look into 20 different again websites and read everything and then to collect to choose, what AI does with its algorithms, it's going to go over 200 websites, and it's going now to look into the content, and it's going to give you like an assistant. It's going to give you a type of brief of the information, again, that is available in 200 sites. So AI is helping us to, again, as an assistant, to do more research job, I would say, but still we need to check the consistency, check the validity of the information so we can work faster. But it doesn't mean that we can work more accurately. Now, when we talk about self-harm prevention, we can also use AI in generating movies, in generating content from the database or the information to which they have been exposed. And we can now have patients going on different types of websites. They can have a chat, just type, they can talk, they can also watch movies, they can also have interactions with different types of AI interfaces, because they have questions about their own nutrition, they have questions about vaccinations, and you already saw those chatbots 20 years ago, okay? And now, of course, those chatbots are not anymore as simple as they were 20 years ago. They are now having algorithms that are more sophisticated. They have processors that are much faster. The volume of information that we can now have is much larger than what we had 20 years ago. And even the speed of access, okay, before you had a hard drive, you had again a local drive, etc. Now everything is on the cloud, and on the cloud, depending again now your internet speed, you're going to access a very I would say fast processing computers that are working on the cloud. It means that they are all interconnected servers, and they are all being accessed by different people at different places with different speeds of internet. This is where the speed of internet becomes also a limiting factor. Now, another area in healthcare is the triage and diagnostics. So what is that exactly? We are having patients. Those patients have information. We need to register those people. We now need also to ask questions about those people, about your age, your level of instruction, where you're living, anything that is of course private, but it's also I would say controlled in a controlled environment. But now we are going to have those people, those patients going to the hospital, going to different places related to the healthcare industry. They are going to generate data on their health status, on their blood, for example. And the data that we have is not just one-time data. You may have a data every week, every 2 weeks, every month, but gradually, but continuously, we are going to receive data related to our patients. So now, when we are having patients who have been treated, or God forbid, not treated, we're not able to be treated, for example, if we are having so many cases after cases with the diagnostics, we are going to see that we are now building a database, I would say a knowledge base, based on the findings that we get from patients. So this is also something very interesting, because more we have the cases in a database, more we have trends specific to a specific age, gender, ethnicity, I don't know, nutritional factors, etc. Better will be our understanding for, I would say, giving services to the population. But in order to give better services, we need to get better data. So we use AI for the triage and for the diagnosis. And now, talking about the clinical decision and support, we already have what we call Internet of Health, okay, or Internet of all medicine on internet, okay. Of course, you may not have access to all of those different interfaces, but when you go to a hospital, for example, they will, a hospital itself is going to allow patients to access some online tools. Those tools are working with AI. Those AIs are connected to specific databases, and those databases are specifically containing information about a specific disease. So we are going to have different interfaces with different, again, I would say interfaces, where they have different databases behind. So if you have someone who is is diabetic, the person is going to go to the interface AI ran interface in order to get to know more about the diabetes, about his or her conditions, treatments that are available, and at the end, the patient may also now be asked if he or she would like to have an appointment with a doctor. Can you imagine how it's interesting? So we can now give access to people to information, accurate and up-to-date information. We can also give them, to some extent, okay, we cannot replace medical doctors for now, but we are going to give them different advices, and then at the end we tell them that if they would like to, the AI system can now use their information in order to get an appointment for them. Can you see how it's interesting and important? Nowadays, I'm sure that as soon as any of your friends, for example, not you, but anyone who may have a cold, the first thing that a person will do is to go to Google and to search, okay, I have a cold, what I should take, correct? I'm sure you have done that as well. So here we are looking into using AI in order to have specific interfaces where people, they can go and they can now look into, again, different services. And through the same services, we can also now help doctors to look into the precedents and then to look into the knowledge base that we have been building for years with different patients. Look into, okay, if a patient has this symptom or these signs, what would be the best treatment? I'm not saying to replace medical doctors. I'm saying that a medical doctor, I'm sure you saw that. You have been to a medical doctor where the person opened a medical dictionary just to double check, or the doctor did open, I don't know, a pharmacopoeia just to double check. Okay, so here we are not replacing anyone, but we are now just using this tool that is going to allow us to do a search very fast using a huge amount of data. And then at the very end, the last person or the first person who's going to decide would be your medical doctor or your nurse or your dentist. The other use is about the care delivery, because as you know, care is not just giving prescriptions, drugs. The care is also for giving, I would say, services for mental health as well. We are looking into AI in order to make simulations as well. So if someone has some phobia, we may now look into building AI applications through movies, questionnaires, surveys, anyways, activities, even games, in order to help people to overcome their issues with their mental disorders. I'm not saying that we can easily finding an AI solution, finding a pill that is going to, I would say, help all of the treatments. No, not at all. What I'm saying is that there's a potential to use AI in order to make different types of interactive applications where it will interact with patients, and we may now contribute into the treatment of some mental disorders. Okay, this is what I wanted to tell you. And of course, the last one here for this slide is chronic care management. Chronic means over time. And when we are looking into the care management, we are looking into different populations in need of having care plans. They are people who need, like people who go to nursing home, they need care plans. So what they should do every day for the next 20 years, 10 years, okay, of course we don't write a care plan for 20 years, but what I'm saying is that those care plans, we continue to make those care plans for people. Now in the care plan, we talk about the activities, we talk about the recreation, we talk about therapeutic, I would say, interventions, we talk about their physical activities. So when we give a care plan, of course medication as well, so when we give a care plan to a patient, we are now contributing into their well-being. And when we are now having different patients who are aging at the same time that maybe their signs and symptoms are also maybe improving, hopefully, but maybe degrading as well, we still need to know about the history of the care plans. It allows us to manage better the chronic care management of each patient. So you see, it's an individualized service. It allows us to look at the trends, changes that we can see in a patient. We can also look into what has been done that was contributing into a well-being of the patient, and how, based on the trends, We can now give a better care plan to the patient, double checking if the care plan is working based on the data that we can get from other patients in different places. Now you see how AI can help us, because it will generate data, it will generate trends, it will allow us to make decisions, it will contribute into the training and informing our patients as well. So this is a tool that should not replace anyone. This is a tool, this is for assisting us to do much more research, much more, I would say, with a huge volume, but at the end we will read, we will decide, because we understand the meanings of what we do. And AI so far cannot understand the meanings. They just look into algorithms. They compare those different words, of course, letters as well, but there's nothing human inside. There's no emotion, okay? For now, maybe one day, I don't know, but for now, this is the case. Okay, so now let's go over the administrative efficiency, because we talked about the use of AI in medical records. Okay, so AI technologies such as process automation are being used for claim processing, insurance as well, clinical documentation, revenue cycle management, and medical record management. You cannot imagine how many people are working on just data entry, while the same people, if the data entry was automated, they could do a much more useful work. So here we are not losing employees, we are using the talents and the creativity for doing things that are again more important, not just data entry. And that's why, can you see, and we had the same function even with Windows 20 years ago, where we were again able to again look into the I would say listening, and then to writing I would say the names or addresses in different boxes. Okay. Perfect. So continuing with the AI technologies, I was talking about the fact that if we are again having I don't know 20 people just writing down the names and addresses, okay, it's okay, but people would be so tired. It's not creative, and it can be done now in an automated process, and we can now use those people to do much more creative jobs. So this is one of the applications for the, I would say, for the use of AI in the administration. Then another one is interactions and support of patients. You know very well that we are having mobile devices too. We have computers as well. And what happens is that we are experimenting the chatbots. Chatbots are they have been there since 2008. Okay, so those chatbots are computer systems or programs where they are going to listen. They can listen to your voice. They can also just write the transcripts, so making your voice into a text, and then they are going to analyze the text and looking into the algorithms, how we are expressing or talking English. Because French is different, German is different, of course, the way that you are making those sentences. But just let's talk about English. They are going to look into different, I would say, nouns, pronouns, verbs, names, etc. And they're going to do the indexation, as well as, of course, looking into the I would say the relationship in between sentences. So what they do exactly is that they are just going to listen to you. They were listening to you, and they were writing the conversation in a file that was in a memory. Nowadays, it's not there anymore. Okay, I'm talking about the old chatbots. And then when the chatbot was writing, it was also responding back to you, now by text, or they were able also to, of course, to make text to voice. And after 30 minutes, you would end up finding out that you are conversing with yourself, okay, because the chatbot was using the same words, your own words as well. It's very interesting. Nowadays things have changed. A memory or not putting in a memory, what those AIs are doing, a system that can again listen to you and change it to text and then to write in the text and respond back to you with a voice, they are able to analyze much faster, and they also have access now again to much larger data, and we can really make sophisticated systems where you can just talk with the system about aviation, talk to the system about medicine, talk to a system about surgery. Okay, again, don't forget, whatever is you're getting from AI is whatever is coming from the databases or information to which they have access or they have been given access to. Okay, so applications that we can make, this can be useful for patient interaction. Okay, I talk about games as well. I talk about different interactions that we can create. We can also talk about the mental health and wellness. And of course, I gave you information about, for example, someone has a phobia, can easily just be trained watching movies, being questioned or being exposed to different information, being exposed to some games, simple games, maybe being exposed to some situations, like for example, someone has phobia with spiders. We may, for example, now use virtual reality, for example, and we can also use AI in order to look into the reaction of the person, and we're going to expose the person to an image of a spider, for example. And then we may now find some type of therapy in order not to scare the person, but to help the person to, again, understand about, the reasons why there is a phobia, and then to help the person to some extent. So we have the tools, or we have the tools that have the ability or the potential to do that. Same thing for telehealth, where we are now using telehealth. Of course, we are still, it's very, very experimental, but we can, as you know, we have robots, they can do surgeries by distance, remote surgeries, for example. Okay, of course, telehealth is a broader term that we use that also includes e-health, but telehealth is health remotely. Now, remotely, it may be you talking with a doctor online, live, but you may also talk with an AI online live, and then the AI is going to refer you to the right doctor or to the right nurse. So this is one way. You can also, again, if you are, I don't know, if you're on the moon, for example, and there is no surgeon on the moon, we have those equipments, but we still need to work more about the dexterity, about the speed of the internet, about the reliability of the internet or any transmission, because you cannot just have a robot doing a surgery on the brain of someone and then suddenly no more internet. Okay, it doesn't work this way, but we have these abilities. We can also, as you know very well, we have robots that we are using in different, in the auto industry, for example, okay? Look into BMW or Mercedes-Benz, okay? They're just easier ones, but you can also look into different pharmaceutical fields as well, where they are using robots and they are having a micron of precision when they are doing something. So we have those abilities even to do surgeries online. Okay, so AI as of now may not be meeting those requirements, but this is one of the applications that we can use with AI, of course. Now talking about the disease treatment and management. One of the important things that we need is data. And as I told you, we can get the data from right sources. But since we are dealing with patients, we also need to get data from patients. So this is why, and again, already you may have some Apple Watch, okay, or you have other watches or smart watches. You also have been, I'm sure, exposed to different monitors, different mobile wearable monitoring devices. And those devices, you can have them all the time with you. Okay, even I tell you, your cell phone is also a wearable device. And when you are walking, if you have I have an iPhone, for example, okay, but it can be any phone. If you have an application which is smart, it means that the application is going to detect that you are walking based on the movements of the phone, for example, it starts to count your steps. Then it's also, if you also have your Apple Watch, for example, it will continue to look into your blood pressure or your heart rate. You may also buy different, again, transmitters, different detectors in order to look into other vital signs in your body when you are doing an exercise. So we can, of course, look into the management of it, the I would say the signs and symptoms. We can also now treat, and we can also check if the treatment is working. So again, AI is helping the healthcare professionals to gather, store, and analyze patient data from wearable and monitoring devices, providing data-driven insights to be better treated and to manage diseases. Another important thing that would like to talk about now is in clinical research. In clinical research, we are also having patients. Those patients are, again, coming, and they are, I would say, go over different visits. They are going to go over some tests. They are also going to, again, take a drug, different doses, sometimes depending on the protocol. And then we will go over a few weeks, few months, few years sometimes to complete a clinical trial to show the efficacy and safety of a product, a drug, for example. But can you imagine the number or the volume of information that we have? This is just very, very, again, I would say it's huge. And what happens is that we need to have AIs in order to manage that data, because one patient who comes will come the next day or next week, another week, another week. You may have one person coming 52 weeks. Each time you are going to have 20, I would say, tests minimum. So now you're going to have about 1,000, I would say, just data. And now you imagine you're going to have 5,000 patients. So it's going to be a huge, I would say, amount of data, number of data that we will need to manage. This is why wearable devices help us, AI helps us in order to, I would say, to manage, again, the activities. Perfect. So now let's go over personalized healthcare treatment. What is that exactly? This is when we are going to use the data that we have in order to find personalized medicine. Again, it's also very soon, I would say too soon for some drugs, but this is coming in the next years, where we're looking into the pharmacology of a person, of a drug, and the pharmacogenetics of a person, and we are going to see for each person what would be a specific dose of a specific drug that would now be more efficient, and of course it's going to cause less adverse drug reactions. So this is the future, of course, and this is coming. Then we can also look into the predictive healthcare trends. What is that exactly? AI is being used to predict healthcare trends by analyzing big data for detailed personal profiling, which may be valuable for predicting healthcare trends and understanding patient needs. Okay, so here I showed you again a scheme, a picture at the bottom, which is about the big data. We already know that with the big data, we have the volume of the data, but we also need to have a valid data. We also have the speed at which the data is generated. We call that velocity. We also have variable data. We have the vocabulary that is used. We have the value of the data. We have so many different parameters that are going to affect the value or the effectiveness, accuracy of the data. So when you have in a clinical trial, for example, 10 million data, okay, just numbers or pictures, it becomes almost impossible to have a human or even a team of 200 people doing that, because we will need to have a fast processor, a database, in order to look into each data and then to look into, again, different variables associated with the data. This is why by using AI, not only we are going to increase the quality, I would say the quality and the depth of the research that we are doing, but we're also going to be able to manage a huge amount of data. And for those who know about the statistics, higher is the number of our sample size, better will be the results of our studies and the statistics. This is why it's very important that we look into AI, looking into those algorithms. And I tell you right now that when you're looking into, I would say, statistics as well, you will see that we can already use AI, and just go to u.com or ChatGPT. We can already use AI for doing our statistical analysis. I can tell you that for my classes, when I teach statistics for research, I do the same thing too. I ask ChatGPT, for example, not chat, go to u.com. I use it in order to generate data for me. And I say, look, generate data for me in order to look into the efficacy and safety of a drug or a device, for example, and make it in this way, etc. I want this for this population, this gender, this ethnicity, this type of drug, this disease, etc. And I cannot tell you how I'm amazed each time to be able to get the data, to use it for teaching, but at the same time, the data that is coming is not created. This is coming from somewhere. This is where, of course, we always have an issue because we don't know where the data is coming from. But for me, this is a real data that is coming from a real study. So for me, it's perfect to do my job. Now, for those who do research, you may not know, some of you may know, but in statistics, we do use SPSS, SAS, R, for example, softwares. Now, you can just go to ChatGPT, or to u.com or any other of those AI interfaces, and you can do your statistical analysis with those. It's just amazing how it saves our time. Of course, you may say that they make errors, obviously. Everyone makes errors, machines as well, but you can always use 2-3 different AIs, giving them the same question with the same database, amount of, obviously, the volume of the information, and then you're going to compare. You can also do your own, I would say, studies or calculations, and then to recheck it with an AI. In both cases, we are now providing a much better service. We are double checking our results. We are now even able to do much more than just 3 months time that we have to do all of the statistical analysis for a clinical research. Okay, so this is where we are moving. Okay, we are moving ahead, forward, and we are using AI, but don't forget again, AI is not here to replace us. AI is here to be an assistant that we still control, we still check as well. Okay, so now let's go back to again 2 slides ago, because in the last 2 slides, I would say that 2 slides ago, I was talking about the personalized medicine. Here I'm talking about precision medicine. That's because AI is enabling precision diagnostics, precision therapeutics, and precision medicine with potential use cases demonstrated across the healthcare sector. It means that we can now have a data from one individual. We can now look into that specific individual, I would say, physiology. And as you know very well about pharmacology, I can tell you right now, or pharmacogenomics. Pharmacogenomics is the extent, or I would say the influence of genes, our genes, on the extent of the, I would say, effect of drugs in our body. Obviously, we don't have all the same parameters for the absorption of drugs, distribution of drugs in our body, okay, our weight, our gender, our age, or so many parameters. We don't have, for example, we don't know everything about, for example, the metabolization rate, okay? I may have a different metabolization rate for caffeine than any of you. And I tell you, this is not always the exact thing. If you're taking the same dose of a drug, we cannot think, we cannot assume that dose is perfect for everyone, as you know very well. Sometimes we take 2 tablets of aspirin, not 1, okay, just 1 indication, but it goes much more in depth, because for each drug we also have not only the effect of the drug, but also its metabolization rate that may be different in different individuals, okay? Different ages too. We also have its effect on different receptors or effectors in the body. Some people, they may not respond to to the same extent to the same dose of a drug. Okay, so what we do now here is that we are um, again use AI because we are having so many variables and so many factors affecting those variables that we need to have a fast system, with huge capacity to do the processing. We need to have algorithms that will still always continue to build as well in order to be able to see, okay, what for this specific person should be the molecule or the dose of which drug, how it's going to be treated, what are the care plans that we can make or write for this person based on the medical history of the person. It's just amazing how we can use AI in the healthcare system, even in the healthcare management system. Now let's talk about the business operations, because I was just talking about, patients, about medical records, etc., or drugs or pharmacology. But the other thing is the business operation in healthcare management. And here I'm talking to you about about the business process management in healthcare management. We have to manage the admission of patients. We need a system for that, okay? And you can imagine how many billions of data that we have in our systems. We also have an emergency room operation where we have to look into, okay, assessing patients. Who should go first? Who should go next? What are the risks associated with any disease condition or any issue that those people they have, those patients? So this is another way that we can use AI to allow us to do the patient assessments. We can also have infection control. We had already COVID. Before this, we had SARS. Before this, we had so many other epidemics. So we can always use AI in order to keep track of changes. And not only AI allows us to look at the trends, it also allows us to look into the future. We can have models to see how things may evolve. For example, you remember that for COVID, we had to have masks, and I'm sure that you saw that governments everywhere, they were saying that, okay, look, for the next month, for example, everyone should take masks, and then in a month, you may now, you have the option to keep your mask or not. But from where that information was coming, how they knew that in the future something should be more or less, I would say, restricted, because of the trend analysis that they were doing. Of course, at the time, we're not talking about AI, because we have been doing what AI is doing now at that time as well. But AI is allowing us to do it faster, and you, of course, managing or using much documentation and database that are much bigger volumes. That's it. Now we can also talk about the drug supply, because as you know very well, we cannot just buy drugs and store them. They all have expiry dates. They also, again, they have to be made as well. So in any country, I'm not talking about, again, other businesses, just for the drugs, we are not going to make drugs and keep them for 60 years. We are not going to make not enough drugs that our population is going to suffer from the lack of, drugs. We are going to look into the trends. Which drug has been used, in which season we need that type of drug. Now how our population is growing. Now we need to have all of those different trend analysis to see, okay, what's happening in the 5 years, the next 10 years, how we are going to adjust our industry, our outputs. Okay, this is where we can also use AI. And again, we have been doing this before. We use AI because of the algorithms, because of double checking, because it's a perfect assistant to me, I would say, assistant that can make errors, but at least it has a huge capacity to do the analysis. And again, at the end, who is deciding? Me, you, not AI. Okay, it's a tool. And don't forget, this will always be a tool. This is my opinion. Then, of course, we can talk about bed management, another very cumbersome, I would say, responsibility in the hospital as well. We also have documentation, same thing. It's huge. I would say, you can't imagine the number of documents that we have now, content of documents, and again, how to use those content of documents in order to, I would say, to have to look into the trend analysis for any patient, for any disease condition, any organ, any drug. Oh my God, it goes, it can go so far when we are having a tool like the AI. And then here, let's talk about the proactive management of health. Because this is what happens, as I told you again in the previous slide. Imagine that we are having an epidemic, and then we are having, again, we need vaccines, and we need to also inform the population. We need to do this as soon as we can. We cannot just ask everyone to go and get a bachelor's degree in medicine, okay? So what we do is that we use AI, and we are going to now monitor patients. We use AI to monitor patients. We are also going to, again, train patients. We are also going to look into the vaccination campaigns. We are going to give information to people, to doctors, to nurses, to different healthcare providers. And we are going to use this tool in order to do a proactive management of health conditions. So AI and the Internet of Medical Things, okay, are being used in consumer health proactive management of a healthy lifestyle and well-being. So all patients they need is to go to one interface. It may happen one day, and then that interface is going to give them different trends. That's what I do now. For example, in December, November, I always go to check the I would say different data related to the number of flu incidents. And it's very interesting because I always look into the flu before I was looking into, of course, the COVID as well, in order to see, okay, how many people are getting and how serious or how risky would be for me to go out, because I am a professor, so I have always to go out, and usually I can tell you that I'm always prone, obviously, exposed to the first I would say diseases that we get in any season. So what I do is that I always look into the trends. I always look into, again, the number of incidents, and what I do is that I go to different places. Now the best thing for me, not just for all of us, is to go to one place, one interface, and look into the number of occurrence of cases. Now imagine that we have that type of interface not just for the flu, but for any type of diseases that may affect us as well, directly or indirectly. And now imagine that we have an epidemic, and now we are going to need to know more about vaccination campaigns. So proactive management is so important in the healthcare management, and we can use it using AI because we are dealing with a huge number of data again. So many data, so many factors that are affecting the data. And again, our brain may not be able to process that, but we can use AI to process it, and then to look into trends, and then to make decisions. But using AI as a very good tool, but again, don't forget, it has its limitations as well. Limitation on the database, limitation on the processes, limitation on the algorithms. And don't forget, I didn't want to go over that, but let's go over that too. Each time that I go to now to AI and I ask for some questions, I still have some I would say statements about an advertisement of a company. Okay, I'm not going to give you which company, but last time, that was before I started this lecture with you, I went on u.com. Okay, it could be any of those AIs, and I just searched for e-signature validation. Okay, it was giving me information, and then suddenly in the middle of the answer, it was telling me, by the way, this company is giving you services for validation of the e-signature as per 21 CFR Part 11. Okay, look, it's just nonsense, and it was completely outside of the scope. So what I'm saying is that, in addition to limitations that are based on the infrastructure or the speed or maybe algorithms or the database, you may also have some other biases, because if someone is paying for a system, it's like information. If we are paying for something, we may always have some bias. And again, it's in any system. Okay, so always use anything with a grain of salt. Okay, just a personal thing that I want to share with you. Now talking about medical diagnosis and treatment plans. We already talked about care plans. Here we talk about the treatment plans. It's just perfect to be able to keep track of, again, the vital signs, medical history, pharmacogenomics, of course, of our patients, and then to look into, again, now how we are going to help our patient if they may have a chronic condition or not a chronic condition. But at the end, it's going to help us to, I would say, look into the trends and then to come up with much more efficient, I would say, treatment plans. And of course, we can also talk about the clinical trials and data management. This is where, and I believe that this is a very interesting topic. It's a standalone topic, of course, for the clinical trials and data management, where AI is supporting stakeholders in healthcare by speeding up the process of medical coding, search, and confirmation of the crucial, I would say, conduct in concluding the clinical studies. So here we can talk about smart card, we can talk about the big data in healthcare, we can talk about the chatbots in healthcare as well, because when we do clinical trials and when we do data management, we can always grab the information, put them into a databases, use them through the algorithms that we use in AI, but at the same time, we can also display them as well. When you go now to any hospital, many majority of hospitals in Canada, you can subscribe to a system for free, and you will have access to your own personal information, even your lab results as well. You can also go subscribe, of course, the first time only, and then you're going to even get some appointments as well. And then you can look 10 years after, you can go back and see when you had which type of appointment, what you have been given, what type of drugs you have been given. So when we have the data, it's not just one way going through just the medical doctors, it's also two ways. So you're going to learn from what you have done or what was your diagnostics or again your treatments. But overall, having an AI system with a huge capacity or ability to process a huge amount of data, and of course to show them to us or to the right people based on the programming, and of course the when we set, of course, some attributes for the access to those data, I think this is just a lovely situation where we can really use it. So again, I would just like to thank you so much again for joining me, because we talked about the AI and the use of AI in the healthcare management. We also talked about the healthcare services. We talked about predictions and predictive medicine. We talked about the patient cares and diagnostics. We also talk about the decision making, of course, clinical decision making, and we talk about AI, pros and cons, of course, okay? Lots of good stuff, lots of good, I would say, useful functions. It's fast. It can really manage a huge amount of data. It allows us to make trends, look into the, I would say, doing into the prospective, but also retrospective data. It's very, very important. And it allows us, of course, to improve our healthcare system through an improvement of the healthcare management and process. But again, don't forget, we use it as a tool, not a tool that is going to make us to decide. We decide based on several tools. One of them is AI. So thank you so much again for joining me. I hope that you enjoyed today's class. Thank you.